Sharon.
Yeah, go ahead, start sharing. We can go ahead and get started.
Okay.
Okay, well, we'll go ahead and get started. I wanted to introduce myself. I'm Dave Knapp. I'm an economist here at the Center for Economic and Social Research at the University of Southern California. I'm one of the MPIs on the Gateway to Global Aging Data, and I help lead the Gateway Policy Explorer initiative. So today we wanted to introduce to you the Gateway's Retirement Policy Series, which is part of the Gateway Policy Explorer. And before we begin, I wanted to, if we can go to the next slide, we wanted to thank the NIA for their generous support. We also wanted to highlight that the Gateway is a free public resource designed to facilitate cross-national and longitudinal studies on aging using the HRS International Network of Studies. And so our goal here at the Gateway is really to facilitate and accelerate research using the international network. And so the Gateway Policy Explorer, and in particular the Retirement Series, is an excellent example of how we aim to provide resources that help contextualize and enable researchers to pursue research. Because, and this is a key motivating principle, the HRS itself is 32 years old now, and many of the other studies in the International Network of Health and Retirement Studies are over 20 years. And so recognizing that, people respond to the policies that are in place when they are taking the surveys. And so it's becoming increasingly more difficult for researchers to actually know and understand what those policies were when people were actually responding to the surveys, because in many cases, policies have changed quite substantially. This is less true in the United States when it comes to retirement, because the Social Security law has been relatively stable since 1983, but this is generally not true when we look across countries within the international network. And so this can really be a barrier for longitudinal research if people don't understand and appreciate the differences in some of these policies. And so our goal here at the Gateway, and in particular the group that collects policy, is aim to provide context in terms of understanding what those policies were at the time of the surveys, or as people experience them that are included in the international network. And the goal here is then to support the broader Gateway effort of helping to reduce barriers for researchers by basically enabling you to use this information, be it the eligibility age for retirement, or the design of a long-term care system, be able to bring that immediately into the data set, knowing that that information and that policy is accurately collected, and those variables are created in an informed way. So going on to the next slide, I wanted to kind of put our overall effort in a broader view. So today we're going to be talking about the Retirement Policy Series, but we also have the Long-Term Care Policy Series, which we'll have a webinar on probably later this summer. And then our Education Policy Series will be released towards the end of June, the beginning of July. So there are several different parts to each one of these different topical areas. So within the Retirement Series, there's the Policy Explorer, where we collect detailed policy. So we link the information that we provide back to the original laws, and where possible, we provide you a translation from the native language into English. And then we do that in a consistent way across the countries for which we collect information. Once we've identified that kind of detailed policy information, we take it to creating harmonized variables, which will also feature here today for some of the Retirement Series. So the ones that we're looking to create, the ones that we first created for retirement policies, are eligibility for public pension benefits. And in the future, we'll also be developing measures that'll help capture pension system generosity based upon individual characteristics over time. And then finally, the other component of this is contextual data. So this is not necessarily data that we are pulling together or putting together, but this is data collected by other data providers that help contextualize the information that we would see at the individual level within the international network. So this could be things like the fraction working by age or the percent in poverty over age 65. The other parts of the series that we would like to highlight are the long-term care. So this has been released and is publicly available as well. This captures things like information on eligibility for long-term care benefits, the care needs assessment, and then means tests. So like what are some of the income and asset tests if they are means tested programs. And from that, we are actively in the process of designing harmonized variables that help capture eligibility for long-term care benefits based upon their health conditions, as well as based on their means. And then contextual data in that context might be things like bed availability for skilled nursing facilities, or the average cost of particular care types. And then we're really excited about kind of our new education policy series that we'll be releasing, like I said, at the end of June, beginning of July, which helps capture compulsory schooling policy over time. So unlike retirement and long-term care policy, where we're particularly concerned about the contemporaneous policy at the time that people were taking the surveys, with things like education policy, we care about the policy that impacted or affected people's behaviors in and around the time they were coming of age. So in this case, right, we're going to be looking at education policy dating back to the early 1900s and as it evolved over the period of the 1900s, because that was the period that affected the birth cohorts within the International Network of Health and Retirement Study. We're also collecting information on education tracking. And for those harmonized variables, we'll from day one have start and leaving age, as well as compulsory school duration by birth cohort and gender. So with that, what I'd like to do is I'd like to pass the presentation over to Alejandra, who is one of our project specialists. I'll let her briefly introduce herself, and then she'll talk about what's part of the retirement policy series.
Hi, everyone. My name is Alejandra, and I'm one of the project specialists working with the Gateway. I'm going to be discussing the different types of benefits we have collected information for as part of the retirement policy series. So as you can see here, we have collected information for 5 different types of benefits. First, we have old age benefits, which are benefits given to older adults after retiring from work based on past employment. Next, we have dependent spouse benefits, which are benefits given to the dependent spouse of someone receiving an own old age pension. Then we have surviving spouse benefits, which are given to the widow or widower of a pensioner. And for old age social assistance, we collect information of benefits given to older adults that do not qualify to receive an own old age benefit based on past employment. So for our social assistance documents, we focus on benefits given as income support to help towards subsistence in the form of direct cash transfers. So for here, we do not consider income benefits such as food stamps or housing subsidies. And for health insurance, we collect information of public health insurance available to individuals of all ages living in a certain country. So for example, we include information of universal health insurance systems for countries that have implemented that. Can we go to the next slide, please? Here we can see the information we have collected for each of the countries. So for own old age, we have collected information on contributions, eligibility requirements, and benefit calculation and adjustments. Benefits may be adjusted for individuals that decided to retire early or later than the statutory retirement age, or that have decided to go back to the workforce after claiming a pension. For spousal and survivor benefits, we have collected information on eligibility requirements and benefit calculation and adjustments. For social assistance, we have collected information on eligibility requirements and benefit calculations. And for the health insurance document, it looks slightly different from the other ones. For this document, we have collected information on eligibility, coverage, and out-of-pocket costs when receiving medical care. Can we go to the next slide, please? So here we can see the list of countries we have completed collecting information for and that are currently available on our website. We have 15 countries available in the Policy Explorer at the moment. So these countries are USA, UK, Germany, France, Poland, Italy, Austria, Spain, Czech Republic, Belgium, the Netherlands, Denmark, Korea, Ireland, and China. The countries that we are currently working on are Sweden, Estonia, Mexico, and India. And the next countries we're planning to collect information for are Slovenia, Portugal, Switzerland, Croatia, and Israel. And then I'm going to pass it back to Dave.
Okay, so we're going to go through a brief example of the Gateway Policy Explorer website, just so that you understand how it works. You can access this as well at g2aging.org/policy-explorer. The key dimensions that we capture in the Policy Explorer are the policies, so the 5 that Alejandra just highlighted, country, and time. And so the idea here is that we want to be able to look across countries in a single year, so be it present day, 2024, or all the way back in, say, 1992 when the HRS first started. Or within a country, we want to be able to look across many years to see how the policy has evolved. And then you can select on specific policy components and export specific results that you're browsing. So I'm going to go ahead and share my screen and show you the website. So this is just our standard landing page here. And so if you go up here to the top of the screen, you can see overview, retirement policies, long-term care, and other policies. So we'll select retirement policies. There is a little bit of a lag when it first starts. So we'll give it a moment. Okay. So there's a brief description up above, and there's a video. So if you ever forget about how to best use the website, you can always watch our brief 3-minute video there. You can see on the policy page that there are the countries that I described, so the 15 countries that Alejandra highlighted, as well as the 5 different policies that she highlighted as well. So we're going to look at one of those policies. We'll pick own old age benefits, often thought about as public pensions. And then we're going to select a couple countries that we're going to detail here today. So we'll pick out the United Kingdom and the United States. So we'll actually begin with the United Kingdom, and then we'll bring in the United States later. So here you can see with the UK, right, that the first law was introduced in 1908, and then there have been several major reforms to the UK pension system over the period since 1992. There's also documentation, which is where we've collected all of the detail that underlies the Gateway Policy Explorer series, and then they get reviewed by an external stakeholder. And then we keep a detailed version number so that you can see how many times it's been revised, and if you look at the back of the document, how it's been revised. All of the documents have a DOI code, and then they have an abstract along with some contents, and each one of them are structured in the way that Alejandra highlighted. So they have an overview, contributions, eligibility, and benefits, and all of this information is going to be mirrored on the website. So we'll continue to look at it there because that's kind of the most user-friendly format. So if we click the View button, then it's going to pop up with all of those policy innovations that we highlighted before. So the UK is kind of an extreme in the number of substantial pension reforms that it has had over the years. So we're going to focus on, say, the time period since the introduction of ELSA, or since the start of ELSA, which is 2002. And I'm going to also back up a little bit in time just so that we don't have quite as many columns going at the same time. So here you can select policy components. So there are the different components that we highlighted. So there's financing, eligibility, benefits, including benefits adjustments for indexation, early claiming, delayed claiming, and work. So focusing on kind of the typical one, which is a claiming age, right? We can see some of the neat aspects of the website. So here we refer to the standard retirement age as the statutory retirement age. And so we see that in this time period, it was age 65 for men and age 60 for women born before April 6, 1950, and gradually increasing to age 65 for women born after April 5th, 1955. There was later a reform that accelerated the change for women so that they actually ended up so that they reached age 65 at an earlier age. Here you can also see, you can hover over table, and it'll pop up with the detailed information of the policy that was in place. So these are based upon date of birth, the date that one would have reached their statutory retirement age. And so this is the information that is going to then be coded and put into the harmonized variables in order to make it more easy for researchers to use, because obviously this table is quite technical. And then as those policies evolve over time, you can see that we also then report the alternative tables. So this is as they increase the statutory retirement age for men and women after 1959. This shows you the planned change in the statutory retirement age. Although it's not represented here, we also have hover text. So whenever there's a technical definition of something, you should be able to hover over it and it'll pop up with that detailed information. Now, if you wanted to look at just this information and walk away with it, there's of course the broader PDF, but if you can always export the current result, and that'll create an auto-generated PDF that has just the information that was featured there. So you see this is for the subset of the years that we had selected, so 2002 to 2009, and it goes ahead and it embeds each one of those tables as part of that document. So this can become an easier way for a researcher to kind of save specific information that they find on the website, rather than trying to copy all of that information. We also include sources. So you can click on United Kingdom, and so you have all of the different sources in the document. We include links as well as an archived version. So usually in the case of a country that English is not its first or is not the native language, we will also include within the archived version an English translation of the law, as well as the law in its original language. So if we wanted to go ahead and bring in another country, right, that allows us to then say, look at a policy at a particular point in time across different countries. And so we can see that in 2020, right, the UK and the US had similar statutory retirement ages. And we could also look more broadly at eligibility criteria and understand what were the requirements for the state for each one of the pension systems. And here's an example of the hover text. So as of present day, right, the UK has what is known as the new state pension. Now, most people in or many people in ELSA, right, will not necessarily have been eligible for that as their initial benefit that was introduced and is effective for men born after April 6, 1951, and women born on or after April 6, 1953. If we wanted to zoom back in time and see what the policy was like in 2002, when ELSA first started, you can see and read about the basic state pension, which was the policy in place at that point in time, and the applicable tables and eligibility requirements for those pension systems. So I think this kind of concludes the initial introduction to the Gateway Policy Explorer. Next, we're going to transition to talking a bit more about how this information can then be ported over and used with the International Network of Health and Retirement Studies to understand how people respond to these policies. So I'm going to stop sharing and let Astrid return to sharing her screen. So this is an example using some of the harmonized variables that we mentioned that we have created as using this policy information. So the notion is that we start off by collecting this detailed policy, and then we want to take that detailed policy and put it in a usable format that researchers can use directly with the International Network of Health and Retirement Studies. So one can imagine, right, essentially based upon a person's birth age and maybe their sex, right, we can essentially merge in this information to tell you if you were born at this point, if this was your birth date, right, then this is the policy that you would have lived under each, at each wave. And so for many countries, right, like the US, right, the people have essentially the same policy in place throughout the course of their lives. But importantly, in a country like in England, right, where the pension policy actually evolved quite substantially since 2002, and even for the same person, right, they would have had there could be a case where they would have had their statutory retirement age actually moved up by a couple of years. That is going to be reflected. So for example, in 2002, you might see that someone has a certain statutory retirement age, and then by 2020, you can see that their statutory retirement age was maybe moved up by a couple of years, reflecting the kind of evolution of pension reform. But once we have these harmonized variables, we can then merge them with kind of the information available in the international network and begin to understand whether or not people respond to these policies. And in the case of statutory retirement age, there's a long literature highlighting that people do respond to these policies. And so I'm going to take a couple of moments to highlight some examples of where we see people responding to the statutory retirement age, which is one of our harmonized pension variables. So just as a quick reminder, we didn't spend too much time dwelling on it, but in the Policy Explorer, you would find that in the US, individuals born before 1938 are eligible for benefits at age 62. So that's their earliest eligibility age, but they're eligible at a reduced rate. So they only get 80% of the full benefit, which they would be entitled to if they waited to claim their benefits until age 65, which is what we refer to as the statutory retirement age. So the statutory retirement age in our nomenclature is where you receive the full benefit to which you're entitled, and the earliest eligibility age is the age at which you can first access any benefits. So this figure depicts essentially the observed claiming age as reported by individuals in the health and retirement study minus their statutory retirement age. And so negative values correspond to early claiming. So you can see here at negative 36 months, that would correspond to someone claiming it at age 62. And you see a substantial number of people in the health and retirement study who were born before 1938 choose to retire in their 36th or 35th month prior to their statutory retirement age. But then you also see that there's a peak at the statutory retirement age where people hit age 65 and then begin claiming. And so this represents, or this kind of reveals, that people are tremendously sensitive in terms of claiming their benefits to the design of the statutory retirement age. And as we look forward in time, if we can go to the next slide, we know that there was a legislated increase in the statutory retirement age by the 1983 Social Security reforms. And as part of that, individuals born between 1938 and 1942 are eligible for their full benefits at age 62 at a reduced rate, and then their full benefits at 65 and 2 months, 65 and 4 months, etc. So in 1938, if we're looking at respondents born in 1938, their claiming age is actually focused specifically at negative 38. So we see a lot of people have actually chosen to still claim as early as possible. But then if you look around zero, right, you see that still a lot of people are responding to that first eligibility for benefits at 65 and 2 months. And so that is still a very salient policy. So now moving on to the next slide, we can ask ourselves how this is reflected in England. So in England, right, men born before 1959 were eligible for benefits at age 65, and women's eligibility actually varied by birth year. So if you were born before 1955 or 1950, your eligibility age was 60, gradually increasing to 65. And so for people born between 1954 and 1955, their statutory retirement age was 65. And in England, there is no distinction between earliest eligibility and one's statutory retirement age. So they don't provide any type of penalty for claiming early. And again, as you saw within the US, right, when we take the policy variable to the data, we see a very strong responsiveness to this policy, even conditioning for the fact that women have very different statutory retirement ages. It's very clear that people are responding to this eligibility because the moment they pass the zero threshold, right, the fraction claiming their benefits is quite substantial. So it's roughly, 28% in the first year to maybe 32, 34% in the year after. And part of this can actually just reflect the biannual nature of these studies. So it's very possible that what we're seeing in year one, right, that roughly 33%, right, is actually claiming at their statutory retirement age. It's just the first time that we get to observe them in our data is a year or so after. And so what we can take away from this graph is that people are very sensitive to claim in terms of claiming their benefits to their earliest eligibility age. And so that is one thing. We can now ask whether or not that is also true for other behavioral things, such as leaving work. So we again see that people are stopping work at many different ages. And so if we look before earliest eligibility, we see that roughly 5% of people or so per year are exiting work for respondents born before 1950. But in the year that they first become eligible for benefits, you see a huge spike in people exiting work. And that continues to be true for the first couple of years after earliest eligibility. And so this is consistent with what we've seen in the literature, is that people's work decisions are actually very sensitive to their earliest eligibility for retirement benefits. And so going on to the next slide, we now return to the US and ask, do we see that same responsiveness in the US? And the answer is again that yes, we do. So for people who were born between 1943 and 1950, their earliest eligibility age is still 62, but their full benefit eligibility age or their statutory retirement age is age 66. And so we see that 4 years before their statutory retirement age, when they're first eligible for benefits, we see a very large jump from roughly 6% to 12 percentage points of the population is choosing to stop working at that age. And it continues to remain high. And what we don't see in the US is the same sensitivity to stopping work in and around the statutory retirement age. So it's really the earliest eligibility seems to be where we see a lot of the behavioral responsiveness. So these have been some examples of how when we take the policy information, transform them into policy variables, here, the statutory retirement age, we can then merge it with the information that we have in the core surveys within the international network to see and understand, contextualize people's behavioral responses in terms of, in this case, claiming and stopping work, but it can be used for any number of things. And in fact, in many papers that have been published, this type of change in the statutory retirement age has been an effective instrument for understanding people's labor force attachment, as you can potentially glean from some of these figures. So with that, I'm going to pass this to Astrid, who's going to talk a bit more about our harmonized variables that we are creating.
Hi, everyone. I'm Astrid. I'll be talking about the contextual variables and how we create them. So to leverage data collected in our policy documents and also to connect and merge the information onto the Gateway's harmonized datasets, we are now creating 3 types of contextual retirement variables. The first set is the country variables, which is specific to the country being coded and could be time varying. Examples of country variables include existence of spousal benefit, existence of survivor benefit, and also existence of gender differences in pension eligibility and indexing of benefits. The second set is eligibility variables, which is coded on an individual basis and could be time varying due to policy changes over time. These include an individual's eligibility for full or early retirement benefits, their earliest retirement age, their statutory retirement age, and also their optimal retirement eligibility track when there are multiple eligibility tracks available in that country. The third set of variables is the benefit-related variables. These include percentage of full benefits an individual could receive due to early or delayed claiming, and their potential retirement benefits relative to their lost income, which is referred to as the replacement rate. And this represents benefit generosity of the system. Worth mentioning is that our team is now prioritizing coding variables for old age public pension, and in particular, the first 2 sets of variables. In the future, we aim to expand our efforts to the benefit-related variables and also other types of benefits, such as the spousal benefit and social assistance. Also, I'd like to mention that the variables we created right now are prospective measures, and they represent current or future eligibility and benefits based on information observed up to that interview wave and policy in place at that interview wave. To create harmonized contextual variables, we generally follow 4 steps. So first of all, we need to identify the policy in effect during our focus period. Our policy documents usually cover the period from 1992 to present, which aligns with the time span of many surveys. And then we clean up and prepare the data from raw datasets or other harmonized datasets to link retirement policy to individual level data, such as respondents' age, gender, work history, and policy in their country at the time of the interview. We run quality assurance checks during the coding process and afterwards, and we typically conduct validation measures using frequency and spread to cross-examine variable results with predicted outcomes based on the policy in place. These validation results are reviewed by researchers for feedback purposes before the data release, so we make sure that the quality is high. And here I'd like to zoom into zoom into the coding process and explain a little bit about how a harmonized retirement variable is actually created. And we are here seeing the example of the eligibility variable, and it is coded for HRS, which is the health and retirement study in the US. So for the eligibility variable, it has 3 codes. So 0 means the person is not eligible for any benefits. 1 means that they are eligible for reduced benefits, and 2 means that they are eligible for full benefits. So the coding process is as follows. First, we need to check for a respondent's contribution history. And for the HRS, we proxy by using the total years worked from their self-report. So if their contribution history is less than 10 years, they're assigned a 0, which means they're not eligible for any benefits. And if their contribution history is more than 10 years, we move on to check for their ages. And here we are using the age at the end of interview for coding purposes. So if the respondent is younger than 62, they're deemed not eligible and they're assigned a 0. However, if they are older or equal to age 62, they're assigned 1, which means they are eligible for reduced benefits. And if they're older than their statutory retirement age, like for example, it would be 66 for people born in 1943. They will be assigned 2, which means they are eligible for full benefits. In addition to the previous coding process, I'd like to mention, due to the nature of the prospective measures, we're assigning missings to people who reported they're already claiming benefits or people who are older than age 70. On the right-hand side, you can see a table of the variable results from the HRS wave 1 of the eligibility variable, where the .A and .O missings were assigned. So the .A means they're already claiming, and .O means the respondent is older than age 70. Also, in other studies where we use life history data for coding, we assign a special missing .L to respondents who did not participate in the life history service. And now I'd like to pass the presentation to Rachel, who will discuss the data snapshot from our contextual variables.
Thanks, Astrid. So now that we've gone over how we code those contextual variables, we'll go over how we can use them in research. The graph on the right compares the planned retirement age for people aged 55 to 60 in the HRS survey compared to their statutory retirement age. The statutory retirement age, which is the blue line, is coded using the method that Astrid described previously. And the orange line, which is the planned retirement age, is coded using the survey question from the HRS, which asks, when do you plan on retiring? So if I can direct your attention to 1996 on this graph, we see that the SRA, the blue line, is slightly above the age of 65, but the average planned retirement age is a little over 63.5. And this is to be expected, as we expect people to exercise the opportunity to retire early, especially in the US. The SRA in the US varies by birth year. For people born in 1937 or before, it is age 65, and it's gradually increasing. For people born in 1960 and onwards, it is age 67. And if we go over to 2020, we see that the blue line is gradually increasing over time. In 2020, the blue line reaches 67 as the average retirement age for people aged 55 to 60. But the average planned retirement age, once again, is below the blue line, but it's at age 65. And here we do see that people's planned retirement age has increased by about 2.5 years in response to the increasing statutory retirement age. This indicates that people's behavior responds to these policy changes, and this policy context should be considered in the research. In addition to the longitudinal research, we also enable cross-country research. And this is because retirement policies depend on a number of factors, including things like income, life expectancy, legal and economic systems in a country, and cultural attitudes and beliefs. Because these factors all vary substantially across countries, we also expect that their retirement policies vary across countries. The table here demonstrates some of the key policy measures in the countries that we've already coded. One point I would like to highlight is our use of eligibility tracks. An eligibility track is just the set of requirements that are needed for a person to be eligible for full benefits. There might be multiple ways for a person to retire or be eligible for benefits, and so in some countries there are multiple eligibility tracks. On the Gateway Policy Explorer, we note and detail these tracks and changes to them over time. They're available in the policy documents and on the website, as Dave demonstrated previously. While some countries have 1 or 2 eligibility tracks, the norm is to have 2 or 3. Countries like Germany, for example, have 5 eligibility tracks. This table also notes whether or not there are gender differences in the statutory retirement age and the SRA for men and women in 2004. We selected 2004 because it's the first year in which all of these countries are represented in the surveys. You can also note here that when there are gender differences in the statutory retirement age, the SRA is typically higher for men than it is for women. In the United Kingdom, whether or not there are gender differences varies by birth year because these gender differences are being phased out over time as the SRA for women is gradually increasing to meet that of men. And in addition to these key policy measures, there are also some nuances in pension systems individually that might not be easily represented in a table. So for example, in the Czech Republic, the statutory retirement age for women depends on the number of children they have raised. The SRA decreases for up to 5 children. For example, in 2004, the SRA for a woman with 1 child was 56, and for a woman with 5 children, it was 53. In Spain and Austria, there are eligibility tracks that are based on birth cohort and when your first or last contribution was made. And this is typical in countries in which there's a substantial change in the pension system and there's a transition period in which people's eligibility tracks depend on when they were born. In Denmark, there's no contribution or work history requirements to become eligible for pension benefits, and eligibility for pensions is dependent solely on residency. This next slide here details our progress in programming these prospective measures. As you can see, the eligibility variables are completed for a majority of our countries, and we are working on the benefit-related variables, such as the percentage of full benefits based on claiming age and the replacement rate. Our goal is to have all of these completed, and again, for now, we are focusing on the own old age retirement variables and not the other retirement variables, such as social assistance and spousal benefits. So on this next slide, hopefully now we've interested you enough in these variables. So here we're going to go over how you can access them. The harmonized own old age retirement variables for the HRS incorporate the first 15 waves of the HRS. That's from 1992 to 2020. It will be released shortly on the Gateway Data Enclave that you can access at g2aging.org/enclave, or you can download it from the HRS data downloads on the University of Michigan HRS data server. The harmonized ELSA incorporates the first 9 waves of ELSA from 2002 to 2018. It will also be released very shortly and will be accessible on the Gateway Data Enclave. The harmonized share incorporates the first, second, and 4 through 8 waves of share from 2004 to 2019. And the harmonized KLoSA incorporates the first 8 waves of KLoSA from 2006 to 2020. And both of these are under production and hopefully will be available soon. Okay, and so as you can see, putting together these policies and coding these variables is a tremendous effort. So I just want to take a moment to say thank you to everyone that works hard to collect these policies, especially the pensions team, Adgar Brugiavini in the Venice team, Maciek Fleece and OECD, and everyone on the USC team, Jin Cook, Dave, Dristan, Human, Astrid, Alejandra, Giacomo, Yichin, Xiao, and Binchian. And to all of the other researchers that help us, and especially to our external reviewers that also help us get this effort up and running. We will now open the floor for questions, so feel free to drop one in the chat or to raise your hand, and we're happy to answer them.
So if there are no questions, we'll go ahead and end the webinar here. You can always reach out to us at policy@g2aging.org if you have any questions or would like to know the progress in creating these variables. So thank you very much for coming today. It's been wonderful sharing our work with you. And again, if you have any questions, feel free to reach out to us at policy@g2aging.org. Have a wonderful day.